Hello, all. Welcome to another episode of Direct Shift Stories. And today we are joined by our special guest, Steve Sullivan. In fact, this is the year of tele-everything. So, in this particular interview, in this particular talk, we'll talk about telemedicine. Is it hype, or how much is it truly helping our communities? Uh, is there a transformation happening with respect to healthcare? What are the kind of changes which are going to happen as the pandemic settles down? Or so let's find out, or let's hear it from Steve. Steve, thank you so much for accepting our invite to be part of Direct Shift Stories. So, with respect to the kind of broad background in healthcare IT, which Steve had with respect to the kind of managing applications or information security, or he worked in infrastructure teams as well. So Steve was into a family of physicians. In fact, his mother holds a PhD in nursing, and sister as a registered nurse at. She also worked for the Red Cross. So he understands the challenges which clinicians face in providing the patient care, and he has got the passion for improving this clinician productivity, or be it patient safety, or respect to saving millions of dollars with respect to the healthcare IT. So Steve, welcome. Could you please introduce yourself to our audience?
Thank you, Raj. I am Steve Sullivan. I'm based in the suburbs of Chicago. I currently am a leadership coach, but as Raj mentioned, I come out of healthcare IT leadership, over 20 years of leadership experience in taking technology and helping clinicians in terms of productivity, patient safety, cost savings, all those areas. And so I'm looking forward to this conversation. And Raj, I don't know if I told you, but my wife is also a nurse. So from the day I was born, probably till the day I die, I will be surrounded by nurses.
Okay, this is awesome. So in fact, it shows in the kind of videos which I had watched on LinkedIn as well. There's lots of caring, but how do we bring back the care to healthcare? I understand for the fact that you breathe in and breathe out, caring, like the way you mentioned, from birth to death, like from the first breath of your life to till the last breath of your life. We know that we are living in a world of tele-everything, but what do you think that will bring back the care into the term healthcare? Because people believe that there's no caring in healthcare.
Yeah, as healthcare has become more and more automated and more productivity oriented, there is that pressure upon the clinicians to move rapidly. And in moving rapidly, they don't always spend the time with the patients that they might like to spend, truly, because generally all those people are very caring and compassionate people to be in this profession. And they balance that in various different ways, depending on what their role is on the care team. But I think you're correct. I mean, one of the great things about today is technology coming in, telehealth. I was just looking at some statistics recently that showed prior to COVID, the Medicare population in the U.S., which is largely people 65 and older, only 1% of them did like virtual conferences with their physicians through telehealth. But through COVID, that's now up to 43%. So COVID has created the necessity for people to reach out and stay isolated. And in terms of how do you care, you really have to care by making yourself available, answering the questions, not rushing through things, showing them that you're listening, that you've heard them. Because far too often physicians hear a lot of stuff and they quickly filter that out and they'll say a response and they'll move on. Where if they just took the time to listen a little bit more, maybe the response that they would give isn't necessarily the response that the patient needs. And so that's a whole nother level of emotional IQ, so to speak, that physicians and clinicians need to develop if they don't have that already.
Yeah, that reminds me that lots of physicians need therapists, or therapists need therapists as well. I love the way you put it across, saying they should be available, they should be they should be available for listening, or they should be responsive. In fact, um, this age of tele-everything also made the term essential from being an adjective to a legal term, because now the way you put it, like COVID had made not only the first responders or healthcare workers, or be it military, fire, and police, are the primary recipients of that particular designation of being an essential worker, but we know that the people working in the grocery stores, people working in the gas stations, people working in pharmacies or warehouses, or be it truck drivers or postal workers, they're all essential workers. In fact, their physical presence had made everybody an essential worker. So thank you so much, Steve. So people should be available. That's again, I wanted to reiterate, or probably put it like the way you said. They should be available. It's not only for listening, but they should be responsive. Are you responding to the need of the community or the need of the people? And that's all about caring. Awesome. So could you tell me what, or could you please share your journey as to what made you get into the healthcare, or how did you land up?
In
Um,
healthcare.
yeah,
Well, growing up in a family where my father was a physician, there were certainly conversations around the table all the time. And so, they would not hesitate to talk about what was going on at work. Generally, they didn't mention names or that kind of thing, but it was more, this case came in and this is what we did. So I learned those things growing up. And as I watched my dad work as a physician, I quickly realized that's not me. I can't, I did not have enough interest in medicine at that young age to want to put in the time and work effort that I saw my father, with medicine, and he'd pick up these journals and read all these things. And I was like, oh man, I can't imagine just, I'd rather be out playing. And so early on, I determined, okay, healthcare wasn't for me. But one of the things I did love was IT. So my parents were very supportive of me getting into IT. And as I started working in IT and establishing my career, at one point early on, I decided, where do I really want to apply my skills as an IT person? Do I want to go into business and finance? And I realized that my heart was attuned to clinicians. And so I sought for an opportunity and found it to get into healthcare IT and started working within that arena, again, utilizing the experience I had from my parents and how to relate to clinicians, as well as now knowing technology and trying to translate that in a way that clinicians can understand and utilize for their practice.
But if given a chance again, would you love to be a
Physician.
physician like your dad, or probably would you again choose only IT? I mean, if this is
Actually, that is a great question because I probably would flip the table. I probably would say, hey, I'd love to be in a physician. And also, because of my ability to learn technology, I would be able to take advantage of the technology today and patient care that my father didn't necessarily have, 50 years ago.
so, like the way you started, were there any also failures as you started continuing with your IT journey? Definitely I agree that you had worked on lots of applications. You managed uh, teams of different mindsets. In fact, people with different backgrounds. So, were there any setbacks? Were there any failures during this journey?
From a career standpoint, not till the very end of it. I mean,
Okay.
I started out with the IT startup. It was the first company to bring out the C compiler for the IBM PC back when the IBM PC had like eight,
Wow.
kilobytes of memory, not gigabytes or trilobytes. It's like next to
Ah,
nothing. You got your floppy disk and all that. And I enjoyed working for them and programming and learning, IT stuff from there. And that was my introduction into IT. And then I transitioned that into a programming position in a hospital and quickly got tapped because of my leadership skills to take on other levels of leadership. In truth, I never sought any of the levels of leadership. I just kept getting tapped by my CIO and asked, "Oh, okay, you'd be a good manager at this. Oh, you'd be a good director at this." And, and so I worked my way up. But like many people in my generation, the older generation, as mergers have occurred, and they're very prolific in healthcare today, two entities come together, and if you're the secondary entity and not the primary entity, you may find yourself on the short end of the stick, which was my case. And they, chose to retain their leadership, the primary leadership, and pretty much dismiss most of us from the secondary partners. So that caused me to leave healthcare directly into consulting and coaching and helping people that way.
awesome. That's the moment you mentioned C compiler from IBM. I'm like, wow. So that could be in 90s, I suppose, or maybe
No, it was
80s.
the 80s. The first C compiler came out in, I think, 1981 with the
Wow.
pretty shortly after the IBM PC came out.
Oh,
Because the company I was with had a couple guys that came out of Bell Labs who invented the C
wow.
language and used the C compiler, and so they started up a business that actually their direction originally was something different, but they realized coding an assembler was not the way to go, and so they had their own C compiler built to enable them to code these other projects. And in the process, they realized, they had this great tool and started selling it long before Microsoft, long before Borland came in, and the big boys that gobbled up the market later on.
Yeah, I guess Bill Hewlett or Dave Packard might be still working on their transistors during those days when you were.
Yeah,
In fact, I knew the HP story because I spent close to 5 years at Hewlett Packard in like the garage story of HP. But that reminds me of you being now being from a programmer. You were a programmer, but again, with your management skills, now you're happy being a coach in the leadership role. So, what are the kind of resources or tools which had helped you like the kind of transition which you had your journey from the healthcare space to being the rediscovered confidence entrepreneur, like being a CTO there? How did the journey transition move into?
Well, as I began to start the entrepreneurship journey, truthfully, it was totally new to me because I'd spent my career in corporate. I had expected my career to probably end there in corporate. And then when I found myself outside of corporate, I knocked on a ton of doors to try and get back in the door. Uh, in fact, at one point in time, my wife asked me to put together a Google map of all the healthcare organizations I had interviewed with.
Okay.
And I had pins in 20 different states of the United States of organizations I had interviewed with. And,
Wow.
a lot of them would bring me back for a second and third position. And it was like, okay, it's a challenge when you're older trying to get back into roles that are often part of the career progression path. And so at that point in time, I said, hey, I'm going to start being an entrepreneur. And now I got a lot to learn.
Okay, so the way you are connecting the dots backwards, like maybe 3 to 4 decades backwards, are there any other resources which helped you achieve the kind of goals which you are trying to achieve? I also understand that you are super active on LinkedIn, helping other people, um, also engaging with the community. So, did you make investment in the coaching business, or how did how did the this particular transition happen? As in, are there any
Well,
resources which had helped you?
as I engaged with people on LinkedIn, especially looking at LinkedIn to help me maybe try and find my next job, through that engagement with many people, they said, Steve, you'd make a good coach. You make a good coach. And
Okay.
so eventually I did uh, go and get certified as a UMAP coach, which is a process of self-discovery. It's a holistic self-discovery process where we look at strengths, values, preferred skills, and personality. It gives you a complete picture of you as a unique individual and how those strengths help you in a career standpoint, how they help you in the choices you make in the relationships and how you interact with people. So it's a powerful discovery process. So on top of that, I've been building a leadership coaching practice, using that to leverage leaders' understanding of themselves and what they can do and where they need help. Because I'm one of these firm believers is maximize your strengths and ignore your weaknesses. Because if you spend time working on your weaknesses, you're not going to prove them very much. And there are going to be things you probably hate. So find other people that you can effectively work with who have strengths in the areas where you're weak, and together you can become an effective team.
Could you please repeat that? Maximize strengths and what to
Okay.
do with the weaknesses? Lower the
Yeah.
weaknesses?
I encourage people to maximize their strengths and ignore weaknesses.
Oh, ignore. Okay.
Yeah. And
Yeah.
sometimes people say, well, why would you ignore weaknesses? That can get you in trouble. Well, if your weakness is you've got a bad attitude, that's character. You need to have the right character. But when I'm talking about strength, I'm talking about how you work. Are you a communicator? Are you a engineer? I mean, there's different strengths that each person has that they can leverage. And so, using that example, let's say you've got in IT somebody who's really good at communicating, and you've got somebody who's really good at building. The building person probably wants to stay in their cube and do nothing more than build. They don't want to be in front of people presenting and talking to people. And if you bring those two people together, now the builder can basically generate the information for a presentation that then the person with the communication skills can take and present to the customers that need to get that message. And so that's what I'm talking about in terms of it doesn't help a builder to say, hey, I'm not very good at communication, it's not going to become better. They're likely to become frustrated because they want to be back building. A communicator, if they're not a good builder, they're probably not going to want to get back into code when they'd rather be talking to customers, communicating to groups and other types of events and functions.
Okay. So it's always a good thing to ignore weaknesses, which is good.
Yes.
So again, with respect to tele-everything, coming back to what we were missing on, we know that Zoom is also a verb, but many bosses are missing their employees' productivity because they can't see them physically. And some bosses are like, go, the telework. Now, again, tele-everything, telework is something which is getting into everybody's lives. The way everything is expanding rapidly, there is a disaster recovery plan. In fact, everybody's productivity is also getting affected by the same. So with respect to work-life balance, Steve, how do you put it across to the business stakeholders? How should they treat their employees in the telework space? As a coach, you know that many of us are working temporarily from home, though we are not working from our office location. How should bosses be handling their telework? Because micromanagement will get us on nerves. It's already because of the physician burnout or like the burnout of employee. Everything is affecting. What would you suggest?
Well, one of the things I did before COVID ever came, 2 to 3 years prior to COVID, is I effectively moved my technology team to work from home.
Really? Wow.
Because they, again, all the work that we were doing was basically logging onto servers and changing values and maybe having phone calls with customers, but they didn't really need to be in the office to do that work. And yeah, I got a lot of pushback. People saying, "Oh, you can't do that. You know, they won't work." And my argument to them was, you think because they're in a cube here, they're working? How do you know whether they're working in the cube? And almost no manager can answer that, because unless you're sitting in the cube with them all day, you don't know what they're doing unless you see the results. And so the key to any work from home program or program in the office is defining key performance indicators. If you've got those KPIs, then you can evaluate your team effectively and say, okay, Joe's performing higher on the KPI than Steve is. And so now what do I need to do to get Steve up to Joe's level? A lot of the managers, quite frankly, don't know how to manage through KPIs. And so they're left with this idea that if they see people, they must be working. And what I often found is when you see people, they're probably talking and gabbing and not working.
Yeah, probably if there is this IRC again, like the Jabber or some software tools internally, people chatting. But I love the way you put it across. Like again, some bosses think seeing is believing, but again, even if they are in the cube, what makes you believe that they're working? That's standard definition. So the idea of telework, I love the fact that you started implementing since 2018. That's awesome. Again, the trust factor of a boss is very important to have the KPIs, which you mentioned, to be positive. Now, again, the OKRs are chasing us. For us, it's again, OKRs always what are your objectives, what are your key metrics, what are the results based upon the kind of efforts which you're putting in. So it's driving me nuts. But again, my boss is remotely monitoring me, or everybody
Yeah.
in the everybody in the
Again,
space.
it depends on what they're monitoring. If they're just wanting you to put out a timesheet that says, "Oh, I did this," that's not managing by KPI. KPI is, what is the work that you need to do? Do you have to make 20 calls a day? Do you have to build 5 servers today? The roles have the tasks that they need to get done. And as long as you measure the task, you can say, oh, okay, Raj did 25 calls a day. He's way up there. But it takes a mentality, which I had with all my teams, which is, I expect you to be professionals. And so when I give you a task, I want you to run with it and do it. I'm here for you. If you have questions and you run into an obstacle or something and you need my help, fine. But I'm going to leave it to you to go execute and then judge you based on the results. And so those are the type of mindsets that I try and teach managers. Because what I found when I moved my team home is they were more productive. In Chicago, we have big commutes. You might have somebody driving an hour into your office. As soon as you take away them having to come in, that's an hour earlier in the day and an hour later that they gain back. And oftentimes what I found is they were already preconditioned to say, okay, I got to leave at 7 a.m. to get to work by 8 a.m. And so they're ready to work at 7 a.m. And if they don't have to get in the car and go someplace or hop on a train, they hop on their computers and they start working. And they actually worked longer. And so again, there are a ton of benefits to remote working. And one of the things that I find challenging is all these companies that want to bring people back in the office now. And I want to wake them up and say, don't you realize by having a remote or virtual company, you now open yourself up to the possibilities of being able to hire the best talent from around the world. You're not stuck with the handful of people that just happen to live in your area or want to move into your area. And so all I know is I feel like I'm barking up a tree with a lot of managers on this one because they haven't learned any differently. Maybe they haven't seen the benefits of it. If they're a micromanager, they're going to hate it because you're right. You can't hover over people and see what they're doing. Although I have heard of companies that are effectively implementing that through monitoring software. So when people are working, it's taking pictures every so often so that the boss can go back through and say, okay, what did you do today? Did you go out to find a date for an hour and look at all the cute girls or cute men? And I bring that up because I had a case of that where HR was spending a lot of time looking for dates on dating things. And it was like, can you check on this, Steve? And since I was a security officer at that time, I could. And I ran the reports and it's like, yeah, there's a lot of looking for guys out there.
The dating sites, okay. Probably. Okay, and also this reminds me, when you mentioned about the travel, that also reminds me, because people are conditioned 1 hour prior to starting their work. Again, their brain is conditioned. So this reminds me of teletravel, because the sales team, not only the employees, but everybody is trying to sell themselves, be it with the code or be it with the kind of skills which they have. Everybody is a salesperson. No matter what profession you are into, no matter what LinkedIn title which we all have. So people have changed the way they articulate themselves to virtual pitches. In fact, people um, have realized that there is higher focus on relevant, consistent communication, which is happening over the teletravel. So people are saving huge on
Yes.
costs, which again you mentioned.
Yeah.
There's a huge benefit.
In the organization that I came out of, we were a big Cisco shop, and so early on we adopted their high definition teleconferencing technology that they had. And man, when you sit in that, you realize it's like sitting in the same room with each other. It's so clear, it's so crisp that you're not in the same room, but yet you can monitor and see everything that everybody's doing just as if you're in the room with them. So that type of technology really, I guess, shrinks the whole concept of, okay, we got to be in the same room so we can see each other, because you can't see each other. Zoom is a different beast in that you've got maybe 10 individual rooms coming together, and people don't always realize that in their room, which is their home, people can see what's going on. Where if they're if you've got multiple locations in a healthcare system like we do, yeah, you might have half your group at this hospital and half your group at another hospital in business rooms talking to each other. So they have more of a sense that, hey, this is a business environment and should be treated as such.
Yeah. So now Zoom had become a verb, more of a verb than just being a company. And I got to know yesterday there's another company which is also going to kill Zoom. Probably I can put it in somebody else's words. Probably it's going to be one of the best online softwares, I should say, like the video of the Clubhouse. Now, like the way the StreamYard, one of the tools where you can stream it to multiple platforms, be it on Facebook, LinkedIn, YouTube, trying to communicate or deliver your message to a broadcast audience. The same way I found this is called as Slingshot. Slingshot is one of the an awesome application which is going to change the way people do virtual events, the way the people communicate. I heard it. In fact, I read it in multiple forums online saying it's like the clubhouse of video, or it's going to kill Zoom soon. It's super interactive. The engagement is higher. Whatever you do in making your tables virtual, making it the UI interface is amazing. So again,
Yeah.
you can
And
Google
when you
Sling
got
to find that.
when you've got people outside of organizations coming together, that type of technology works. One of the things I've seen with businesses is many of them are becoming smart to realize that, hey, they've signed up for Microsoft 365, and within that is the Microsoft Team app. And so they're using the Team app multidimensionally. You can do video conferencing, you can do audio conferencing, you can just do texting and sharing of documents and various things that Team app does. That's all, you're already paying for it as an organization if you've got a subscription to Microsoft 360 with in place in your organization.
Awesome. Now let's move on to tele-education, Steve. Like we spoke about tele-work, we spoke about tele-travel, we spoke about telehealth or telemedicine. Again, we'll come back to the teletherapy or taking pills based upon the prescription, on the availability of the physician, or on the availability of the remote care, like the way the RNs or the nurses are helping remotely. Again, that's part of it. But let's move on to tele-education, Steve. How are children coping up? I know though my children are 10 to 12-year old.
Yeah, mine are in college and older, so I have not had to deal with younger kids in basically elementary, junior high, high school, and my wife and I have both been thankful. Like, I don't know how we would survive if we had to homeschool our kids during this period of time. So I commend all those mothers, fathers that are successfully doing that. And in fact, I think what you'll see is potentially even a swing towards home schooling more. That existed before COVID, but now that people have seen and gotten into a routine of homeschooling, if the mother, the father enjoys doing that, there's all sorts of stuff online that you can homeschool your kids without them going back into school. Now, each child is unique. That's one. I've had 4 kids. I know there's no such thing as you have one kid and they clone. No, they are totally separate creatures with their different interests. It's so with tele-education, you're probably finding kids that maybe struggled at school because of the social pressure and dynamics at home, finding, wow, I don't have to deal with that stuff. So now I can focus on studies and excel. And then you have the reverse. You have the people who want that social dynamic and they're at home like, oh, where's my friends? Where's my friend? And they're not really focusing on schooling or studying and possibly falling behind because they prefer to be in class and interact with their friends and maybe even have their friends, where they could have over at home, and then they kind of maybe hold each other accountable like, oh, gee, we got to get this report done for class, so let's work on it together. So that's occurring. But when you get like into healthcare, e-learning has become very powerful as a tool. It was there before COVID in two different ways. One, you think of e-learning in terms of training the clinicians, but it's also there in training the patients. I can remember seeing some very effective things put together for surgeries, where if you were going to undertake like a gallbladder surgery, you could go out and see kind of a 3D rendering of what the doctor was going to do, how they, worked on your body, and help educate you to understand what the process is, and work into that also things like, hey, remember, don't eat or drink before, 12, 24 hours beforehand or whatever, afterwards, make sure you do this. Those kind of directives get built in that education, and potentially the patients hear that better than if the doctor just says, hey, do this, do that, and they may or may not remember it. But then the other side of that is the clinicians. If you've got a big health organization like my wife works in, you've got, I think, 11 hospitals in her healthcare system.
Wow.
She's in one of the biggest healthcare systems here in Chicago. But they have to train nurses in each of those locations. Prior to COVID, they talked about how to pull nurses into, 2 or 3 different locations. And since COVID, they've moved more towards how to do remote training to nurses, either at home, taking the training, or within the hospital that they normally work.
Yeah, again, nurses are probably, again, the tele-education is also playing a huge role, like the way you put it across, with respect to surgeries or 3D rendering, the technology is helping out there. But what about the mental health? Because pandemic parenting, it's driving nuts. In fact, I love the way you mentioned it's a huge honor for all the parents who are facing the challenges, educating their children, coping up with the reports, or helping the children. But we know that the mental health space, probably the kind of emotional quotient which they are going through. How should parents handle, like, what would be your solution for pandemic parenting? Because you've been successfully done with the parenting for 4 kids, as the way you mentioned. But what about other parents who are coping up? Somebody with not kindergarten, but primary school or high school, not only the work pressure, but the children pressure. How should they deal with this kind of tele education?
That's a great question, because the the mental health aspect is a major impact of the shutdowns, the lockdowns. We weren't designed to be really locked down. We function better when we're out and about. We can meet people, we can do activities, we can do things. And so the lack of being able to do those activities is affecting certain individuals. Others, if they enjoy engaging online, they've got that as an outlet. And so for kids at home, the question becomes, what activities can you maybe help them engage with other kids online?
Okay.
Or, again, if you're in the inner city, it's different than if you're in the suburbs. In the suburbs, you might have a yard where you can say, hey, I want you to go out and kick ball for an hour every day. So the kid gets outside and gets some physical activity, because physical activity is a great medicine for mental health. And my mom was a psych nurse. Her PhD is in psych nursing. And she would always say, if you're depressed, you're down, Steve, go out there, get the axe and chop some wood. Because she grew up on a farm, so chopping wood was pretty common. And I do that once in a while, because the bottom line is, if you go out there, that physical activity takes energy, and it pulls away some of that bad energy, distracts you from those things that are creating that bad energy, and hopefully giving you maybe a feeling of, hey, I'm accomplishing something, and replacing it with a feeling of accomplishment.
Okay.
So
Awesome.
tell your kids to go chop wood.
Again, your partner, Karen Markham. I'm just picking it from
Yeah.
the LinkedIn bio, which you have it out there. What about people seeking inner strength, emotional well-being? How do people stay away from the toxic work environment, getting glued to the computers, sitting? Because some people who are about to complete their job in 4 to 6 hours now are spending 14 to 16 hours. Um, they're spending they're being workaholic, or probably as they are not supposed to step out of the home under quarantine. Everybody is glued to their screens. What should one do to gain the inner strength?
Well, you need to plan breaks from that, for sure. A lot of when I'm coaching people about confidence, it comes down to the stories people tell themselves. And and all my clients, I tell them, the tongue has the power of life and death. So if you speak positive things, you will bring about a state of health. If you speak negative things, you will bring about a state of dying. And that's not only true in terms of the words you use towards somebody, but it's also true in what you tell yourself inwardly and what you think inwardly. And so to those people, I encourage them to begin to identify those negative messages and turn them into positive messages. Use affirmations. And it's a challenge for some of them, because they're caught up in this world of comparing themselves to others, or they're caught up in listening to the opinions of others. and responding to the opinion of others instead of saying, hey, you're an amazing person. That's who you are. And you are worthy. Just say this: I am worthy.
Yeah, worthy.
And in saying that and taking that in, you can begin to silence the inner voices that are telling you you're not worthy, you can't do this, or you can do that.
Awesome.
So that's what
I love the way you put it again. Again, the tongue is so powerful. So this would be my last question for you, Steve. Um, Again, I know people can reach out to you through confidence, redefine I'm sorry, rediscover confidence. The confidence,
confidence rediscovered. So yes.
confidence rediscovered. Now, I had a question of confidence, but as we are focused on tele-everything, teleconfidence is also one of the major things which many people shy away from because they're on screen. People are judging them like the way they speak. I love the way you do your videos, kind
Thank
of
you.
energy you put in. So again, this is a beautiful website. I have not seen on any speaker whom we invited in the last hundreds of days. But this is something which I love. A collage of all your posts, which is um,
They're
like
older posts, but yes.
I love the Steveism. like so thank you so much for sharing everything. So the way we narrate stories to our own selves defines how great we can be a tele leader. Not only the leadership, again the leadership skills will also show how we speak to ourselves, how we speak to others, how we engage, how we communicate. But this is a for all the listeners out there. Uh, Please get in touch with Steve Sullivan through LinkedIn, or you can go to this website, stevesullivan.fiu.to. In fact, this is an older website which we agreed upon. It's not been updated, but I guess this would also I wish this should be dynamic because every time you share something on Twitter or LinkedIn, I guess it should auto populate here. Um,
It would be good if it did that, but it's all manual, and I haven't been good at being manual, updating it because my focus is on trying to crank out a new website, a personal website.
yeah, but I've seen on few speakers, they have this plugin and they have a special tab or they have a special element within the website which keeps on scrolling. I guess I guess it's been automated because it doesn't look like a manual intervention. Because the moment they share something on their social media, it auto populates on their website. Also, I've seen a couple of websites like that. But
There are
thank you
tools
so much,
available.
Steve. The last 48 minutes was golden time
Thank you.
talking about tele everything, right from birth to death. It's, I would say, tele breath again. Though I'm in India and you from Chicago, this tele conference or probably tele meeting had done justice to the kind of topic which we had chosen. And thank you so much for bringing in insights. At the beginning of the talk, I was a little skeptical as to how it's going to be. I'm trying to be frank here, but
No, that's
I,
fine.
I love the answers, the way you put it. So again, with respect to confidence rediscovered, if anybody needs to be better at whatever they're doing, or if anybody needs to be a better version of themselves, I would strongly suggest you to please get in touch with Steve. You'll also see little bites of this, like a social media 1 minute or 30-second teasers on our platforms, again through social media, be it on LinkedIn, YouTube, Facebook. So before we wrap up, Steve, do you have any last minute things which you want to share with our audience or with our clinician network?
I would just say to people that if you're struggling to be the leader that you want to be, or question whether you're the leader you need to be, reach out to me, and we can look at how I can help you achieve those results and move from a sense of, feeling like you're not doing it, to a sense of, yeah, I can do this. I've got this. And now I'm going to be so much more successful.
Awesome. Thank you so much. Thank you so much for that, Steve. It's been an awesome conversation, and you will be able to catch up these direct shift stories again on Apple Podcasts and Google Podcasts as well. You can listen to the same, and I'll talk to you again soon, Steve. I'll send you the recordings. And for all the audience, if you're watching the replay, do share your feedback or leave in your comments. Or if you catch the snippets of this entire interview, do let us know how you felt. Thank you so much, Steve. Thank you for accepting our invitation once again, for sharing all your insights. Thank you so much. Have you been to India, Steve? This would be
I have. I spent one day in Calcutta.
Oh, okay.
Because I was
putting namaste. I'm like, that made me ask the question.
Yeah, because I was traveling to Nepal, so I spent like 3 weeks in Nepal, but my travel took me through Calcutta, and yeah, that was an interesting day I spent there, and I would love to come back to India, work with people there, businesses, whatever. So thank you for inviting me on your program and allowing me to speak to your audience, which is an audience that, yes, I love, but I hardly ever get to speak to because you're on the other side of the world at a different time.
But I love the way you completely narrated. It was an awesome story, bringing in your family, also different experiences from your mom or dad, again, your partner, or probably the way you put it across, including the 4 children you mentioned. But again, we'll get into the details later on. But appreciate all your time.
Thank you.
So our team from Chicago or Illinois and New York, they're traveling to India in July. They are in US for last 16 years. They keep traveling, they keep shuttling. But you should also get in touch with our CEO Vamshi, who couldn't be part of this particular interview today, but they'll be able to get in touch with you again, LinkedIn, or you can ping them. But thank you so much, Steve. I'll talk to you soon again.
Thank you.
Bye-bye.
Bye-bye.